Andrew Plitt here with andrewplitt.com. This video is the first video in a very special series that I'm putting together. As some of you may or may not know, I'm currently a naturopathic medical student, and I'm in my last year of training for this program. And as part of this program, something that we're required to do is something called community education hours. And this is just an opportunity for students as they're going through this program to educate their community in different health-related subjects. What I chose to do for my project is put together a short series about Tai Chi and Qigong that is really aimed towards students and healthcare practitioners. And the idea is to give students and healthcare practitioners tools that they can use to manage stress in their own life, improve their own health, and their own sort of mental well-being. And for the healthcare practitioners out there, my hope is that the tools that you learn are things that you'll be able to pass on to your patients when you determine that Tai Chi or Qigong is something that would be useful for your patient. So this first video is really an intro to this series, and we're also going to be discussing some of the current research about Tai Chi that is making Tai Chi more and more commonly used in the healthcare community as actually prescription for people who have specific health conditions. But before we get into that, I want to give a little bit of background about Tai Chi. I know most people have some idea of what Tai Chi is, but for those of you out there who have maybe heard the term Tai Chi or maybe seen a few things about it here and there, but aren't really sure what it is, I want to talk a little bit about its history, a little bit about what it is. I don't want to go too deep into that because I know there's a lot of information out there available. If you're curious about what Tai Chi is, just Googling Tai Chi will give you more information than you could ever possibly want to know about Tai Chi. So I'm just going to give you a really brief summary, a really brief history on Tai Chi, and then we're going to move into the research that's available and look at a systematic review that talks about Tai Chi and different ways that it can be used for specific medical conditions. So we'll start first with the question, what is Tai Chi? Now, that question sounds quite simple. It seems like it should have a very simple answer to it. It can be a very in-depth discussion that goes into a lot of aspects about Tai Chi and the concepts behind it and its history, all of these things. I don't think we need to go that deep today. Really, for our purposes, all we need to think of for Tai Chi is that it is exercise, it's gentle, typically slow moving. There are forms of Tai Chi such as Chen style that has more fast movements in it and slow movements, and it mixes those together. But the majority of styles are typically slow flowing movements, and it tends to be a very meditative practice. A lot of people have referred to Tai Chi as moving meditation. So for our purposes of this video and this series, when we think of Tai Chi, what we're going to think of is slow meditative exercise, slow meditative movement. It's a way to get your body moving, to do it in a safe way, slow movements, gentle movements for the body to stretch, strengthen, and support the body in a way that's typically very accessible for people of all ages. So now let's think about why these movements were developed, these slow meditative movements that are gentle on the body, great form of exercise. What was the purpose behind developing this in the first place? Now, the origin of Tai Chi is something that is somewhat debated, but what seems to be most supported in historical records is that it was developed in Chen Village in China, and its original purpose was as a martial art. So when you look at Chen style Tai Chi, you see that there is a lot more obvious martial applications to it. It tends to have more explosive movements along with the slow meditative type movements that we're used to with Tai Chi. And this is a great spot to talk about a couple of details about Tai Chi before we go on with the story of Tai Chi's development. The first thing is that there's different styles of Tai Chi. And as we go through a little bit of the history of Tai Chi, you'll see where some of those styles came from. And basically what it means when there's a style of Tai Chi is that there's someone who took the concepts of Tai Chi, the original Chen style Tai Chi, and they basically changed aspects of it, keeping the core principles the same, but sort of expressed those principles in a different way. And typically that style of Tai Chi would go after the family name of the person who developed that style. So Chen style Tai Chi was developed by someone whose family name was Chen. Yang style Tai Chi, the same thing. Yang Lu Chen was the one who took Chen style that they learned from the Chen family and changed it to be their own style of Yang style Tai Chi, et cetera, with Wu style and so on and so forth. So there are different styles of Tai Chi and they typically have different characteristics, although they're based on the same principles. And the other thing that I want to mention is what's called a form in Tai Chi. So as we think of Tai Chi, we think of these slow meditative movements, and what you often see, like if you see people practicing in the park, is they're going through a series of movements that are prearranged, predetermined, and it's what's called a form. So a form is a set of movements that are basically already standardized. You're going to start with a certain movement, it's followed by this movement, the next movement is this, you go through this set, and then you finish after a certain number of movements. That's what's considered a form. So if I refer to a form as I'm talking about Tai Chi, I'm basically talking about a predetermined set of movements. Now, Tai Chi, of course, can be practiced in other ways. People can do free-flowing Tai Chi where they have different movements that they know from Tai Chi and they just decide to do it in whatever sequence seems natural to them. There's a lot of variations, but we're not going to get too much into that in this video. So now we can get back to the history of Tai Chi. So Chen style Tai Chi was developed by Chen Wangting, And he developed it, as I said before, as a martial arts, a means of self-defense. And Chen family members would work as bodyguards and as caravan guards, and they were basically very well known for their fighting ability. And Chen style was considered so effective that basically they kept it within the family. So Chen family members could learn Chen style Tai Chi. Anyone else who wanted to learn it, kind of tough luck, no one else was able to learn it. It was kind of their family secret. Well, eventually someone named Yang Lu Chen came along, and he ended up ingratiating himself to the Chen family and was able to learn the Chen family fighting style. And the story goes that he went on, after learning Chen family fighting style, Chen family Tai Chi, he went on to the capital in China and ended up taking part in a martial arts competition and was able to beat all the best fighters in that competition. So he was nicknamed Yang the Invincible at that point because he was such a good fighter, and he was basically hired to train the bodyguards of the imperial family at that time. And this is, of course, a very surface level telling of this story. Anyway, Yang Lu Chen, or Yang the Invincible as he was nicknamed, was also instructed to teach his fighting style that he was using to the royal family. And basically, as legend has it, he was under strict instructions not to teach Chen style Tai Chi to anyone else because it was still supposed to be a closely guarded secret. So there's different ideas about why exactly he changed what he changed in it. Some people say that he changed aspects of Tai Chi to match the Yang style of Tai Chi because it was too rigorous as a Chen style form of martial art, and trying to teach that to the royal family was just expecting too much of them at their fitness level. The other idea is that he changed the things that he changed basically to stylize it so that he wasn't actually teaching Chen style Tai Chi, so he wasn't like breaking his promise to that family, but at the same time he was able to teach the principles under an altered form of Tai Chi that was his own style, so it was okay for him to teach it basically. So Yang style became sort of the first popularized style of Tai Chi that was taught kind of more openly. And from this popularization of Yang style Tai Chi, other styles started to emerge as people kind of took those principles and made them their own. And there's just a ton of different styles of Tai Chi at this point in time. But sort of the main ones that people tend to think of are Chen style, Yang style, Sun style, and Wu style. And then some people say that the second Wu style is also very common in those top ones. Some people say it's Jiaobao style, and there's a lot of debate about that. None of that's really that important. Basically, I just wanted to give you an idea of where Tai Chi came from and sort of the progression into multiple styles and why there's so many styles today. But with this change from Chen style, where it was this sort of more aggressive style that was focused really on martial application, to Yang style, where it was both used for martial application, but then also kind of made a little bit more friendly for people who maybe weren't in the best shape. It really popularized Yang style as something that could be a form of exercise for people. And people really started to get into practicing Yang style of Tai Chi for exercise really early on in its evolution. And the popularity of Tai Chi as a form of exercise really has only increased over time. And Yang style continues to be sort of the most popular form of Tai Chi around the world today. And there are millions of people who practice Tai Chi on a regular basis for many different reasons. There are people today who still practice Tai Chi as a form of self-defense, as a martial art, and that's their primary focus. Like the fact that it's exercise is great, the fact that it's meditative is great, but what they're really interested in is self-defense and fighting skills with Tai Chi. That's probably the least common use of Tai Chi, but it is still one of the uses. And people continue to use it just as a form of exercise or as a form of stress management. And one of the great things about Tai Chi is that it's so versatile. You can have wildly different goals from someone else who's practicing Tai Chi, and you can still practice Tai Chi with other people and work toward your goal in Tai Chi while they work toward their goal. Now, there are a lot of concepts and a lot of principles that are inherent in Tai Chi practice and are very important for Tai Chi practice. And we could spend a lot of time talking about details and really minute things that could take us videos and videos and videos and still never cover all of it. And since our goal for this video is really just to give you key aspects of Tai Chi that you can use as tools for yourself or for potential patients, I'm not going to delve into a lot of the more esoteric sort of concepts such as Qi and life force and yin and yang and all these different things that are associated with Tai Chi. They can be very useful things to kind of give you a conceptual framework of Tai Chi, but I also don't think they're absolutely necessary if what you're wanting from Tai Chi is stress reduction, if you're wanting flexibility, if you're wanting strength, if you're wanting health improvement as a form of exercise. Those sort of things aren't really that necessary to know for the benefits of Tai Chi to be available. And of course, if you want to get into those kinds of things, I have a lot of videos on my YouTube channel that go a lot deeper into the concepts of Tai Chi. So you can do a deep dive on that there. You can go, of course, to Google, find more than you'd want to know about Tai Chi, and really get deep into the different concepts of it. Again, that's not really the point of this video or this series. So we're just going to leave it at that. We're going to get into some of the research about Tai Chi and some of the health conditions that it can be useful for. Okay, so the primary article that I'm going to be discussing today is this one that you're seeing on the screen now. It is this clinical evidence of Tai Chi exercise prescriptions, and it's a systematic review. So for those of you who are not familiar with systematic reviews, basically this is where they take a bunch of different studies that are looking at something similar. In this case, it's the use of Tai Chi for various health conditions or for healthy populations, and seeing what are the common prescriptions for this. So how long people are doing it each day, how many days per week, and for how long, how many weeks are they doing this? And is it making a difference for the different conditions that they're looking at? So I would encourage you to read this article if this is something that you're interested in. It does have a lot of great information. We're going to go through and just kind of hit the highlights of it and carry on from there. So one of the first things I want to point out in this article is that they do discuss the fact that there are different styles of Tai Chi. As far as what they looked for in the research, what they were able to find is that Yang style is the style that has the most research available on it. So the majority of the studies that they're looking at are looking at Yang style Tai Chi. They also look at studies that discuss Sun style Tai Chi, Chen style Tai Chi, Wu style Tai Chi. These are all styles that I briefly mentioned earlier. And then there's a few other either non-traditional styles or unspecified styles that were also included in the articles that they were reviewing for this article. And when they were reviewing these articles, they found basically top 10 conditions that were discussed, but rather than looking at individual conditions, what they really looked at was groups of conditions. So they looked at diseases of like the musculoskeletal and connective tissue systems. They looked at diseases of the circulatory system, diseases of the nervous system, respiratory system, et cetera. So they're looking at kind of systems and seeing what sort of benefits Tai Chi had for disorders that relate to those systems. And again, I'm not going to go through all of the details for each of the systems that we're going to be looking at, but I am going to mention some highlights from each of those systems. When we look at the musculoskeletal and connective tissue systems, one of the things that was found in this review is that people who practice Yang style Tai Chi 24 form, and so when I say the 24 form, it basically is a set of movements, 24 movements, that is kind of a standardized form that is probably the most practiced form in the world right now. And they found specifically with practicing that form, patients with osteoarthritis showed improved physical function, reduced pain symptoms, and improved quality of life through practicing that form of Tai Chi. They also found that those patients had improved balance and reduced risk of falls with practicing Tai Chi. So a lot of times when we think about osteoarthritis, there's not a ton of things that you can think of that it's just like all these things are going to be great for people with osteoarthritis. So to me, it's very exciting to see that Tai Chi is something that can not only improve the symptoms that people are having with osteoarthritis, but according to this study, this review, it also can improve quality of life and reduce risks such as falling and improve people's balance. So it's not just addressing the one thing, it's addressing other aspects of their life too. And with each of these things in this article, they discuss specific forms and specific styles of Tai Chi that were looked at for different conditions. I'm not going to detail those out in this video because that's just going to take extra time. And I think if you just look at this article, it's going to be very clear to you what was used for what. I'm just going to basically talk about the reported effects of Tai Chi on these different body systems and conditions. And if you want the details about what form of Tai Chi, what style of Tai Chi, etc., then I would encourage you to look at the article itself. If we move on to circulatory system diseases, they found that Tai Chi was beneficial. It can help reduce blood pressure and control weight and improve both metabolism and quality of life in people with hypertension or with high blood pressure. So this is something that, again, is very exciting to me because it's not just addressing the hypertension, it's addressing other aspects of what can be contributing to that hypertension. They also found that in patients with hypertension, Tai Chi can improve their physical and mental health, just kind of more general measures, again, addressing things that are not just the hypertension, but could be contributing. And they also saw a reduced risk of cardiovascular disease in patients with hypertension. And that to me is also very exciting. Additionally, they found in stroke patients that there was improved cognitive ability and improved sleep quality and improved depression symptoms. And again, there are other conditions that were looked at under the circulatory system, but those are the highlights that I'm going to hit from just that section. Then if we move on to mental health and behavioral health disorders, there were studies that demonstrated Tai Chi was helpful in different mental health and behavioral health disorders. This to me is very exciting and very useful, especially now as we're getting kind of toward the tail end of this pandemic. Hopefully we're getting toward the tail end of it. And we've been seeing mental health disorders, depression, anxiety on the rise as this pandemic has continued. And so there's kind of a mental health crisis going on right now. There's not enough providers to meet the demands. And of course, this is in no way saying that Tai Chi will take the place of a good mental health professional, But at the same time, they were able to show in studies that Tai Chi can help improve symptoms of depression. It can help improve symptoms of anxiety, ability to manage stress. And in patients with cognitive impairment, it can improve cognitive function and the memory of those patients. So we see general good things for mental health, for behavioral health, and for situations not only of cognitive impairment, but also depression, anxiety, stress. And those are things that I think we can all relate to at this time in history. And so to me, the fact that Tai Chi has been used to address those things, and it's not something that you need expensive equipment to do. It's not something that you need a whole lot of requirements. It's not a high barrier of entry sort of exercise. If you can get on YouTube, if you can find someone who can teach you, like there's a lot of different ways to get access to Tai Chi. It's something that can be practiced. It's something that can be used. And I think for the healthcare professionals out there, as we're looking for ways to help patients who are struggling with things like anxiety and depression, yes, there's the standard things that we can do to help them. But if there's a way to add something like Tai Chi that's going to help improve the depression, the anxiety, and can be something that's kind of a safe space for them to kind of connect with themselves, reduce their stress, breathe, meditate, and get exercise at the same time, then this has, in my mind, a lot of potential, and it's very exciting to me. Now we can move on to the nervous system diseases. Something that was found in patients with Parkinson's disease is that practicing Tai Chi can improve balance and motor function, and it can also improve quality of life and the physical function, ability to function of patients with Parkinson's disease. In addition to that, patients who have moderate sleep disorders also found improved sleep quality with practicing Tai Chi. So as we can see, like Tai Chi is hitting a lot of different systems through the body as we're going through. And it's becoming more and more obvious to me as I go through articles like this, as I look at the research that's available about Tai Chi, that this is something that I'll probably be recommending to most of my patients. When we move on to the respiratory system, one of the main things that was looked at was COPD. So that's chronic obstructive pulmonary disease. And in this review, they discuss how Tai Chi, when it's used by patients who have COPD, was able to improve exercise capacity, reduce the symptoms of dyspnea or shortness of breath, and also improve the quality of life of patients who have COPD. So again, with this being a low cost, low risk kind of intervention, something that can be added to the standard of care for COPD, it seems very exciting. If we move on to metabolic disorders, they also found that patients with type 2 diabetes were able to improve their glycemic controls, improve their triglyceride levels and their resting blood pressure rate and their heart rate with the use of Tai Chi. So as you can see, there are a lot of systems in the body that are affected by the practice of Tai Chi. But something that I appreciated about the study is that it also looked at healthy populations to see what was changed in those populations when they practiced Tai Chi. Now, the populations that were in the studies that were reviewed in this article were mostly middle-aged to elderly patients. So some of this information may or may not be able to be applied to younger populations, but we do know it can at least be applied to middle-aged to elderly people. And some of the things that they found in healthy populations that practice Tai Chi is that there was improved balance, improved postural control, and reduced risk of falls in elderly people. They also noted improved quality of life, reduced stress, and improved leg strength in elderly adults as well. Another thing that they reported that I find absolutely fascinating is that in elderly populations who practice Tai Chi, they found an increased antibody response to the influenza vaccine. So it seems like their immune system responded better to that vaccine, offering more protection potentially when they were people who practiced Tai Chi versus people who did not. Now, I haven't looked at that article specifically, and it's just one article that's mentioned in this review, so I don't know how extensively that has been researched and how strong that evidence is, but that's something that was found in at least one study. In the discussion section of this article, they also talk about how the characteristics of Taiji training matches the exercise prescription guidelines by the American College of Sports Medicine, the ACSM. However, they do discuss the fact that different styles of Tai Chi express Tai Chi in different ways. And if you were to use Wu style or Sun style, you're probably going to have less intense Tai Chi practice, less physically demanding Tai Chi practice than even Yang style and especially Chen style, which tends to be probably the most physically demanding style of Tai Chi. So more research is definitely going to be needed to look at how different styles of Tai Chi meet the exercise prescription guidelines by the ACSM. However, they did say in general that Tai Chi matches the classifications for at least moderately intense exercise. Now that we've talked about a lot of different ways that Tai Chi can be used and a lot of different body systems where it can show benefit, it begs the question, like, how much Tai Chi do you have to do? Is this something where you're doing Tai Chi all day, every day, and that's why they're seeing benefit? Or is it something that can be done every once in a while and you're still going to get the benefit? Well, in each of these body systems in this article, they talk about kind of specific Tai Chi exercise criteria or prescriptions that were used for the different studies. But in general, when they kind of summarized the most commonly used forms of Tai Chi prescriptions, it basically came down to only 60 minutes, 2 to 3 times a week for a minimum of 12 to 24 weeks before you start seeing improvement. So that's a great starting place for future healthcare professionals or current healthcare professionals. If you're wanting to know how much Tai Chi should be recommended for patients, this is a great starting place. Of course, that can be varied based on clinical judgment and the condition of the patient and the age of the patient and all the different things that would go into that decision. But in general, this article kind of came to this conclusion that an ideal minimum prescription for Tai Chi would be that 60 minutes, 2 to 3 times a week for 12 to 24 weeks as sort of the baseline. And of course, more can be practiced than that, but that's sort of your minimum amount to really hope to see improvements in different health conditions with using Tai Chi. So that is just one article that discusses the benefits of using Tai Chi in healthy populations and populations that have different medical conditions. Now, the fact that it's a review article does lend additional strength to it because it is looking at multiple studies rather than just looking at one specific study or the outcomes of one specific study. But there are a lot of other articles out there and a lot of information about what conditions Tai Chi has been used for and been studied for. So I want to introduce you to a great resource that can be used both by healthcare professionals or just general population if someone's interested in the information that is currently available about Tai Chi. And that is information that is on the NCCIH website. So this is the National Center of Complementary and Integrative Health. And they have a whole page dedicated to Tai Chi and what you need to know about it. And so they give you a brief description of what Tai Chi is. But the thing that I find very exciting about this page is that it has different populations or different conditions. And then when you click on that, it summarizes kind of what the current information, the current research is on that condition. So if you have a patient that you're working with that has osteoarthritis, you can look here and see that there's a good amount of research behind that. Something that I think is quite exciting here is that it says that the updated 2019 guidelines by the American College of Rheumatology and Arthritis Foundation strongly recommend Tai Chi for the management of both knee and hip osteoarthritis. So the benefits have been good enough that it's actually reached the level of being recommended by the American College of Rheumatology and Arthritis Foundation. So it's definitely something that's quite exciting, I think, for healthcare practitioners to have this tool to recommend to patients to support their health and their overall well-being that is low cost and low risk. And I wanted to point this page out because it is very easily accessible both to healthcare practitioners and non-healthcare practitioners to see different conditions that have been researched and what Tai Chi can do for those conditions potentially based on the research that's available. So of course, none of this information is to say that Tai Chi can be used in place of proper medical care. And of course, if you're going to be starting Tai Chi, you should definitely check with a healthcare professional before you do that to see if it is the right thing to do for you and if it's safe for you to do. So now that we've talked about some of the research that supports Tai Chi's use in managing either medical conditions or supporting just general health, and this, of course, is just barely scratching the surface of the research that's available out there, I would highly encourage you to look more into this if you have spare time and the inclination to do so. But where can we go from here? And that's really what this series is about. So we've talked about some of the research about Tai Chi, how it can be useful. And that is good information. That's a great reason to look further into the research. And if you're a healthcare practitioner, to say, I need to find some Tai Chi instructors in my area that I can refer patients to if that's something that you want to do as a part of your practice. But the point of the series isn't just to tell you that Tai Chi is amazing and it's good for you and it can be helpful. The point of the series is to give you some tools that you can use and you can implement in your life and potentially teach to your patients so that they can implement it in their lives. So in the next few videos, I'm going to be teaching you some basic Tai Chi principles and some basic Tai Chi exercises that you can do on your own or that you can easily teach after you've learned them to people who could benefit from Tai Chi practice. And I've been studying Tai Chi since I was about 13 years old was my first introduction to it. I've been to China twice, training 6 to 8 hours a day, 5 days a week for nearly 2 years. And from my studies in China, I earned advanced level teaching credentials while I was there. And while I was in undergrad, I taught Tai Chi part-time while I went to school full-time. So Tai Chi has been a big part of my life for a lot of years. It's something that I have relied on heavily during school, during the stresses of going through a doctorate program. It's something that I'm not only qualified to teach, but I really enjoy teaching. And so I hope these videos are useful for you. And I hope that they really make a difference for you and for your patients. And one thing that I do want to point out about the next videos in this series is as I'm teaching you the different principles and movements and exercises for Tai Chi, basic understanding, basic practice, I am going to be wearing clothing that's similar to traditional style Chinese clothing. And I want to explain why I'm going to be doing that. It's really because when I was training in China, what we did when we would do our gradings or our exams is we would dress in more traditional style Chinese clothing. And it was basically a way to acknowledge and respect the tradition and the culture that these arts came from. So when I wear this clothing, it's basically, again, a nod to the culture and the tradition that was brilliant enough to develop these arts. And this information that I'm passing on to you, of course, is not my information. This is something that I was taught. These are things that I had to work hard to learn from others. And so when I teach these arts to others, I typically stick to a more traditional style of clothing that's similar to what we used when I was training in China. With that said, I hope this series will make a big difference in your life and in the lives of your patients. And I wish you all the best in your future and in your training.